Hello, this is Jim Kenzel from ASA. I just wanted everybody to know who's online that we will be starting the webinar in approximately 1 minute. So stay tuned, everybody. Okay, it is 1 p.m. Central Time, 2 p.m. Eastern Time. So it's time to start the webinar. We have a lot to cover in the next hour, so I wanted to be sure to start on time. And hello, everybody. As I mentioned earlier, I am Jim Kenzel, the ASA Staff Liaison to the ASA Safety Committee. And welcome to all of you to this ASA Safety Committee webinar on COVID-19 and safety in the workplace. The purpose of this webinar is to discuss guidance and best practices for opening up buildings that were shut down during the pandemic and maybe starting to be reopening up, and also ways to keep the workplace a safe workplace as we move forward related to COVID-19 and other potential environmental quality type contaminants that you'll be hearing us talk about today. I would like to recognize the ASA supplier partners for their contribution to the ASA. You can see their logos here on the screen. The reason I proudly display the supplier partners, it's because of their donations, significant financial donations to ASA, that we are able to provide these type of webinars free. So thanks to all of you for your contributions and support of ASA. It is much appreciated. So many of you provided pre-webinar input on questions you have, and thank you for that. We have tried to incorporate the questions into the panel discussion. During the program, if you have questions, please enter your questions into the comment box. And I will be monitoring the comment box to see if the questions they come in, and I will feed them to the panelists as we progress. You will hear during the discussions on potential health risks outside of the exposure of the coronavirus. This is appropriate because it is becoming clearer every day that our built environments are seeing increased impacts of health risks related to and impacts on the environmental quality that we need to be concerned with. For instance, Legionella and future pandemics. So this goes beyond just COVID-19 today. This is, we hope too, as the panelist discussions, you will hear us talk about other potential contaminants as well as future impacts on our businesses. As a reminder, our panelists are providing their expertise and guidance today, but I caution that the discussions during this webinar should not be considered legal counsel. Policies and practices you develop to reduce the risk of COVID-19 or other contaminants and health risks in your environment should be reviewed by your legal counsel before implementation. Let me introduce our panelists for today's discussion. And to the panelists, I'm going to ask that you raise your hand when I mention your name so people know who you are. To the participants, we apologize, but David Kraus is in a secret witness protection program, and we're having trouble getting his actual face coming through, but that is David Kraus in the shadows there, so you'll see him raise his hand. But let me start off with Tim Keane. Tim Keane is a consulting engineer with Legionella Risk Management is an internationally recognized expert on methods to control the risk of Legionella in building water system design and operation and mitigate issues. He has 40 years of field engineering experience, including new construction project engineering, facility engineering, water treatment consulting, and the last 18 years focused on building water system design, operation, maintenance, and co-development for waterborne pathogen mitigation and control. He was a member of the ASHRAE 188 committee since 2005 through publication of the 2015 and 2018 standards. He has routinely presented at ASHRAE and ASFE conferences, offered training seminars to plumbing designers, infection control, and building maintenance. He has worked with federal, state, and local health departments, as well as building owners, operators across the U.S. in outbreak investigations and resolutions. Dr. David Kraus, who you can almost see, David, raise your hand, just there you go, is the founder and principal toxicologist for healthcare consulting and contracting in Tallahassee, Florida. He is also a certified industrial hygienist and licensed mold assessor. Dr. Kraus received his doctorate in environmental occupational health and Master's of Science in Public Health from the University of South Florida. Over the past 25 years, he has practiced environmental science and public health, focused in the areas of toxicology, occupational health, industrial hygiene, indoor air quality, and exposure to microbes and chemicals in homes, schools, office buildings, and healthcare facilities. From 2008 to 2011, Dr. Kraus was state toxicologist for the Florida Department of Health and led the state's efforts to investigate public health risks associated with corrosive Chinese drywall and the Deepwater Horizon oil spill. David is a recognized expert in risk assessment, workplace exposures, healthcare facilities, Legionnaire's disease, combustion products, flame retardants, internal chemical exposures, and mold. He co-authored the 2009 Guidelines for the Surveillance, Investigation, and Control of Legionella Disease in Florida, and a 2015 AIHA Guideline for the Recognition, Evaluation, and Control of Legionella in Building Water Systems. David Bush.
Thank you for having me, Jim.
You're welcome, David. David Bush, an associate of the firm, and David, your firm is, I forgot to write it down.
Corey Ullman.
Thank you.
We're in southeastern Pennsylvania.
Concentrates his practice on insurance defense and civil litigation. His experience includes trying numerous jury trial cases to verdict in premises, liability, and automotive matters. He also practices in the area of nursing home and medical malpractice, commercial and construction litigation. He formerly practiced with the United States Department of Labor, specializing in occupational and mine safety and health, together with representation of management in labor and employment matters. Wow,
Thank you.
We've got ourselves some experts on this panel. I am humbled to be with the three of you and to be involved with this, and I thank you all for taking the time and spending this time with us. So I will be asking the panelists questions, and I will typically direct those to an individual on the panel. The other panel people will come in. So as a reminder to the audience, please enter anything, questions as they arise as we go forward into the chat box of your GoToMeeting control box. So let's start off our discussions. Oh, by the way, one more thing. At the end of the, we will be probably bringing up different documents as the panelists speak. At the end of the presentation, I will be bringing up a slide that will show you where to get those documents, the links to get to them, and all of that. So that'll be showing up at the end of the webinar. So let's get going on the questions and the discussion. So David Kraus, I'm going to ask you first, and then I'll open up to everybody else. But let's start off right at the beginning of the first question is, what are the considerations a company should even take in deciding whether to reopen if they were closed down? What should they think about? What should cause them thinking along those lines and actually make that step to go forward?
Certainly, certainly. Hopefully I'm off of mute. That's my favorite trick. Um, One of the first things people need to consider as a owner, operator, or manager is what are the public health and regulatory guidelines for your specific area. While one state may have a a release, the neighboring state may not. Cities that are on a border may have employees that are in another state and may have different rules that they need to be addressing. So look at the current public health guidance and regulatory requirements for your operations where you're at. Is it worth it? If you're going to open up a store and you see that your neighboring, maybe your competitors are having 3 people a day coming into the office or into the retail establishment, maybe it's just not worth it because you may open but nobody may show up. Beyond that, you really need to look at your staff and your customers and perform a risk assessment. That can be a back of the envelope thing, or it can be a more formalized event. But look at what you can do to minimize and manage the risk of exposure and to minimize and manage the risk of infection in your staff. That needs to be looking at several layers, and we'll get into that a little bit later. But beyond the infection related to COVID-19 is your facility, the building or campus that you operate on. We've been closed down for a while, and Tim's going to talk a little bit more about this later, but we recognize water systems may have sat stagnant for a while, and that could pose a hazard for lead, waterborne pathogens, sediment, debris. A lot of issues can come from that. Look at your fire suppression systems. Look at your electrical systems. Look at your any life safety issues that were supposed to have been inspected, repaired, addressed during the shutdown. We want to make sure we don't do we don't mess up in the easy stuff, and then because we're so hyper-focused on the pathogens.
Yeah, it's it's the old adage, everybody's wearing a face mask and we're taking their temperature, but the water system's contaminated and they're all getting sick from that. So it's and we're going to get to that. So thank you, David. Just want to give the other panelists an opportunity if you want to respond on that general question about how do I decide to even open up my facilities if they've been shut down, or how do I decide to bring my people back from working remotely back into the facility? I mean, what is that high level thought process, Dave or Tim, if you want to add to the conversation?
Well, Jim, from my standpoint, the threshold consideration would be, am I ready to reopen? Should I reopen now? Once you get the legally approved to do so by the governor or whomever, whatever your state is, whatever your shutdown requirement is, are you prepared to open immediately? Obviously it makes perfect sense. Yeah, as long as these businesses have been shut down, obviously from a commercial standpoint, you want to get right to it. But bear in mind that in the event, and unfortunately in my job, I have to look at all the potential issues down the line. We look at problems and we invent problems in our minds, thinking to advise our clients. So that's one of the questions we're going to be asked. Well, if I open today, even though it's legally permissible, am I exposing myself to potential liability if one of my employees, or if you're in a type of business where you have a commercial customers that come in, if they become exposed, am I then subject to liability for that? And as we were discussing off the record, you're always going to run into somebody. The argument you're going to be facing is, oh, well, you put profits ahead of safety. So once you do have obviously you do have a threshold argument to say, well, if the government approves the opening, then I have at least a legal basis to do that. And there's somewhat of a presumption that it's safe to do so.
Yep.
I would suggest that you plan from this point, if you make your plans in advance as to what your policies are going to be, what can you do, secure as much information from these gentlemen and whatever sources are available, CDC, OSHA, whatever, as to recommended policies and practices,
Yep.
and have something in mind. Don't just open your doors and then play it by ear. Be prepared so that you can address a lot of the initial questions right off the bat, and then you can deal and tailor your situation to the circumstances as they develop.
Yeah, I think the good news is based on some of the questions we got from the registrants prior to the webinar. I think a lot of people are doing that based on the questions we have. So they're asking the questions before they reopen.
Yeah.
So that's good.
Yeah, it is.
Tim, let's move to the concept that David brought up, and one of in fact, it's the concept that you and I first connected. And for everybody else, I've known Tim for a long time. Due to our ASA's involvement in the Legionella standards and the ASHRAE standards that we mentioned in Tim's background. So I've known Tim for a long time, and Tim came out with a publication around reopening during COVID-19 and the potential impacts and health risks related to the water systems, which got me to reach out to Tim, which started this whole concept of this webinar. So Tim, can you talk to us about that additional risk beyond being exposed to COVID-19 or the coronavirus? Can you talk about that additional risk that David alluded to in opening up and restarting up our building systems?
Absolutely, and kind of follow up with what David said. All three of us have a lot of legal experience. Dave Bush is an actual lawyer, and David Kraus and I are involved in litigations and have been involved as expert witness. One case came to mind from what Dave Bush was saying as far as you got to have plans and you got to be prepared. In one case, a document that was uncovered was a memo of a meeting after a Legionnaire's disease outbreak at a hospital, and the hospital was required by code to have a risk management plan. And the meeting notes said, went to Google to find out what we should do. That's not a good position to be in when you not only not have a plan, but you have notes that document you had zero preparation. So there is going to be a risk, and a lot of us are concerned of the risk for serious outbreaks when these buildings that have been stagnant are opened, and that water that's been sitting there with potential of corroding the lead and causing higher lead levels and potential for bacteria growth. So I did write 2 documents that are on my website. I know IAPMO's posted them on their website. I'm not sure who else has posted them as well. The first one is titled COVID-19 and Legionella Preparations to Consider for Municipal and Building Potable Water Systems Now. And so those are things that can be done now, touching base with your municipality. If you are in a commercial district with a lot of other buildings that are shut down, because your municipal supply might be impacted, it might be stagnant, and the municipality might need to do some flushing. And what you can do to a building water system immediately prior to opening to reduce the risk for bacteria growth. And the other document is titled Developing a Building Potable Water System Flushing Program. And it's in depth on what you need to do to be compliant with ASHRAE 188, what buildings have to comply with ASHRAE 188, what buildings don't, what you should do to flush the building out. For instance, if it mentions if it's a small building with a home hot water heating system and no circulation, all you need to do is turn up the temperature and flush with high temperature, and you have minimal risk. If it's a large building with a large complex plumbing system, it goes through step by step on how to flush the remains coming in and flush your equipment and any type of potable or non-potable equipment. So those 2 documents are pretty much at a ground zero level for a maintenance person to understand. And then there's other documents on the website as well that go into a higher level for public health and for associations that are preparing their own documents.
Thank you, Tim.
And I'll throw this in there as well, Tim.
Good.
I mean, Tim's been doing this a long time, and this comes by as second nature to him. This will not be second nature to most facilities operators, building owners. So seek help, seek guidance, hire folks like Tim to reach out and help you guide you through this. This is not a good start for a DIY program.
Yeah, well, and that is in my document. If you're going to do water treatment or get in chemicals, you definitely have to get a consultant. But one of the misnomers that's out there that I tried to address in my document is people say for anything you need to get a consultant or an expert, and you don't. If you've got a small restaurant or a small office with a 60-gallon home hot water heater, you can do that yourself, and that's included in my document. And basically turn the temperature up to max and have 130 degrees coming out of the faucet and flush it, and it's a pretty simple thing to do. So those options are listed there. If you have a complex system, you might need a consultant, and if you definitely have a big system, you probably do need a consultant. Good point, David.
And if I may, let me just add, this having been advised of this, and it's great to go out and get the information, but you can't just sit on it. Once you got the information, you've got to do something. Ignorance of the law is no defense, but neither is knowledge and inaction. And in fact, very often that's even more problematic, as Tim and I know from a case we worked on where you do have information and you say to yourself, it doesn't apply to me for X, Y, or Z reason. And you may even be right, but that isn't necessarily going to defend you, immunize you from liability. And it certainly isn't going to immunize you from somebody making an accusation. Again, the more you do, at least you're showing reasonable efforts, and then you have the that is the first step. But you don't want to be sitting on a body of information. Well, yeah, I got all this stuff. Well, what did you do with it? Well, we didn't do anything too much, whatever reason. That could even be more problematic.
And there's a lot of good information and not good information as well coming out every day on this. So, David, I'm going to turn to you, and I'm going to talk or ask you a question about in the OSHA and CDC guidelines that have come out. They talk about risk levels, and they talk about the type of steps you should be taking dependent on the risk level that an employee is involved with. Can you talk a little bit about that and sort of give everybody that understanding of the different risk levels?
Well, as far as an employee and what their exposure is or what their job titles are, again, this is very qualitative, and I think you need to understand the context of this as it's being put out there. One, they're trying to give a framework, some rudimentary guidance to employers. Two, this is like guidance from my mother-in-law. She hasn't been there. She doesn't know what I do. This is from, frankly, from well-intended academics, regulators who have never done what you do. So, it's a floor, it's not the ceiling. And, beyond that, the risk levels are very qualitative. And I think, trying to establish which people in your organization fall into those risk levels. So if that helps put it out there as it's well intended, it is very likely to change. And that's one thing that when we get into these legal cases, what was the standard of care? Well, what day was it? And things are moving so fast in this situation, it's a day-to-day kind of thing. In Legionnaires, it's what year was it? And the standards have been changing rapidly from year to year or every 3 to 4 years. But this is happening so fast that I don't think you could look at anything and say that was the definitive standard of care, because we don't even know that any of this standard of care that is being put out there is going to work. 6 feet? Well, I saw something the other night. It's 12 feet. Okay, well, 12 feet. What does that mean? You really couldn't even be in most buildings then. So, the risk levels I wouldn't put a whole lot of weight on.
Yeah, I think the point and the reason I asked the question was that I guess I wanted to make sure that our participants were even aware they exist. I think going back to all of you said it, the information out there, it's out there. You've got OSHA and CDC guidelines. They are pretty high level and all of that. But I think the risk levels is one way people can look to say and evaluate and go through that questioning process that Dave Bush brought up earlier about, okay, where are my employees positioned? Where do they fall in this risk level? And here's what we, at least today, this is probably the type of things we should do, and we need to be monitoring to see how it changes tomorrow. Any other
Jim,
thoughts?
I would like to make people aware of something that's just recently come out from the American Industrial Hygiene Association. It's called, it's a website called backtoworksafely.org. Again, backtoworksafely.org. Sponsored by the American Industrial Hygiene Association, and free online downloadable resources for that are been developed for specific areas such as retail, hair and nail salons, gyms, construction, home service providers, and others will be coming out as well. So this is a place to keep an eye on and to get some more, I'll say, where the rubber meets the road on how do you address this once you're given the okay to open. What things can you what steps can you take to reduce the risk across the board for your employees and your customers?
Yeah, thanks for bringing that up, David. In fact, that'll be part of that last slide I showed today. We'll have that link to that website. And I don't know if you mentioned, but I think they even have one for general office.
They do.
Yeah, I saw it. And I read that one, and it really, it looks like it takes it to the next level from the CDC and the OSHA guidelines to really start giving you even more specifics. So thank you for bringing that up. I think it's
it's not into the weeds, but it's at least into the forest.
That's again, and we'll bring it up again later, but that's I always want to say the AHIA, I don't know why, it's the AIHA, Industrial Hygiene Association. So thank you for that. Hey, Dave Bush, I wanted to come back to you because we did get a question, and you brought up the concept of documenting earlier. And one of the questions we got in the survey, which was, do you recommend to document the actions along the way? And can you you sort of touched on it, so you can, since that was a question we got, can you jump on that and give us your thoughts?
To me, that is a classic conundrum that we deal with in the law. Do I do it? Don't I do it? If you do it, in many instances, it is the best approach. For instance, I used to, when I worked for the United States Department of Labor, the best thing you could have, particularly in labor relations, but in any, either with OSHA or mine safety and health, is documentation that you took measures to address concerns and problems. You need a paper trail. It's a paper trail, if you in law, is really in many ways one of the most compelling avenues of proof. If you can show a long line of documentation, but then again, now you have the difficulty with it. For anybody that's our age, they remember Watergate, the missing 18 minutes of tape.
I read about it in history books.
On Richard Nixon's tape. Nixon used to tape his people coming into the Oval Office. It was unbeknownst to the world until one of his aides brought it out during the hearings, and so naturally that was a bombshell. Well, what really sank him was the fact that 18 minutes were missing. If you've got documentation, it has to be comprehensive. If you've got gaps, you've got problems. If you've got something that you're going nicely along, and in either way, it could be that you're comprehensive up to a point, and then all of a sudden you just happen to be missing documents that relate to a potential or an alleged outbreak. You've got serious problems. On the other hand, if your documentation is spotty and isn't well kept, and unfortunately, I've run into clients, some of whom it still amazes me that they do business without documentation in contractual matters. So now if you implement a policy that we're going to document that we took temperatures at this time, that we provided masks, we provided gloves, we had a send home policy on these, it has to be accurate. It has to be consistent. If you've got gaps, you've got problems. And worst of all, and this, it's again, the law is so much common sense, but we see it ignored all the time. Never, ever falsify documents. Nothing. You can't have, so, oh man, I forgot to write that down, and then backdate it, put it in, and then 2 hours later, when your shift ended, 15 minutes after you were supposed to write that, and that can be documented. Never do that. Never have somebody sign your name for you when you didn't, or whatever. Certified documents with your signature that is incorrect or false. That I cannot stress that more than anything. It may not even be a legal document at the time that you're doing it. Oh, I didn't give out those masks, but I will, or I gave whatever. They've got to be accurate.
Good advice.
Spell
Good
something
advice.
correctly, but if you add something that didn't happen, that is, you couldn't do worse for yourself. So it's a blessing and a curse.
Yeah. So the other thing I'm gonna add to that, Dave, is, and don't lie to the FBI.
Oh.
Okay. All right. So I want to get to two major topics. In fact, we were debating to show you how things are changing. This illustrious panel we have with us has had several debates on certain issues as to what is the right thing to do, which is a good thing. So I want to make sure we cover two areas before the webinar closes out. So one of them is related to what to do with when you find an employee has an illness, and what do you do about it, or is showing symptoms. Actually, it's three. Let me start off with, people have been asking about temperature taking and that type of thing. So I want to address that. Then I want to address, what do you do when you find somebody in the workplace that is it? And then third, the whole question of face masks. I think we probably got the majority of the questions we got related to face masks. So those are the three areas I'm going to move to. So basically, the OSHA guidelines suggest policies developed related to the prompt identification and isolation of sick people. So let's talk first about that, to identify. And I'm first going to ask Dave, from a legal standpoint, your thoughts on that. And most people think about taking temperature to identify, a self-declaration type thing, and those types. So from a legal standpoint, what does that mean to you when the OSHA is saying have something in place to identify? What do we need to be careful about?
That's a tough one, because obviously you would want trained professionals at some level who would be the best ones to identify somebody. We've discussed the issue. We've got people that are completely asymptomatic that come in. So right off the bat, you're dealing with a class of people and a particular type of ailment that, Tim and I addressed it. It's a secret. It's only, or the unknowns that you can't see and you can't tell. I don't know that just simple, one size fits all testing is the way to go. I think that would be problematic. Mandatory temperature, or taking temperatures in the entrance, that to me, I also have some issues with that. I think you start with your policy identification. For the most part, I suppose we could trust most people call out sick even at some time in their life when they're not sick. But typically, you would try to implement a workplace policy that would suggest that if the employee believes themselves or has a legitimate basis to believe themselves exposed. For instance, they have a family member that was just exposed and they're now incurring or experiencing symptoms, that call outs are, as I said, a more liberalized call out policy, so that a lot of places, especially non-contractual places, would have limits on sick days. Businesses may have to really start biting the bullet on that and permitting more, more sick leave, at least until somebody can verify whether or not they have the symptoms. The other one would be you get a call out policy that if you do go out, if you stay out on your own, or that if you're sent home because you've experienced them at the workplace and have presented that to your employer, and your employer sends you home, now you've got to up the ante in terms of, say, doctor's notes to bring back. Typically, my understanding, it was general, a lot of places go on the 3-day rule. If you're out 3 days, you have to come back with a doctor's note. Perhaps you implement a policy that if you legitimately have reasons to suspect and that you have coronavirus, you have to be back. You have to have a note within a day, or you have to have the testing to ascertain whether you can come back. If somebody shows up at work and they're feeling okay, and then they approach a supervisor, an employer, and they say, "Oh, I'm starting to feel really lousy." At that point, you are on the side of caution and say, "Okay, you can go." Again, we talked about either urgent care centers or simply, whatever they need to do, but businesses, again, erring on the side of caution, I think is probably the best route. Temperature, again, thermometers, physical contact with, unless it's by a trained professional, I would not be in a hurry to encourage. You don't want a staff person who has no medical training whatsoever taking a temperature, because again, you may even have a mechanical issue. If you get a false positive, or worse, you get a false negative on your thermometer, you're better served having a policy with medical staff in place. Obviously, I'm sorry, go ahead.
No, okay. So I was going to ask Tim. I know Tim and David, before we started the webinar, you both were talking about actual examples with clients around taking temperature. So I wondered if each of you could sort of elaborate on those examples, talk about how it works. Tim, I'll let you go first, maybe on your experience.
So I was in some hospitals with some significant rates of COVID in the city, and they had implemented a policy that they had employees at every entrance to the building, and this was a big building, probably around 10 different entrances. The employees were not trained nurses, they were regular staff, and they had forehead infrared thermometers, and they tested everybody. Everybody got a sticker every day saying they were tested that day. So you could see people walking around that were tested. And I can tell you, when this first started, I had anxiety. I mean, I'm sleeping at this hospital. I'm working there. Paranoia crept in, high rates of illness. It was a panacea maybe, but getting my temperature checked every morning and knowing I was good, it made me feel a little bit better. I think for the visitors and the people coming in and the employees, it all gave them a sense of well-being, that they were being aggressive as they could be. It's not going to solve all the problems, but they were being as aggressive as they could be in trying to address the issue. So I felt really comfortable and very good that they were taking temperatures. They did not keep a log of everybody's temperature they took, but they did keep a log of those that failed and that were sent home. So that information was maintained. And if you failed, and the funny thing is, David mentioned about floor level and CDC and OSHA. I forget what CDC says for offices, but it isn't temperature. For hospitals, CDC says take temperatures of everybody coming in. I don't understand what the difference is. To me, the temperature is a quick, easy, very fast thing to do. It's not perfect. You may not have a fever and you may be spreading, but it's a very aggressive step that you can take.
David, your thoughts?
Temperatures, when we talk about a test, we talk about sensitivity, specificity, positive and negative predictive value. This is specificity. So a temperature is a very non-specific sign, something is measured. And one, not having a temperature doesn't mean you don't have COVID-19. Having a temperature certainly doesn't mean you have COVID-19. You could have any number of other things, including allergies, can induce a temperature in some folks. So it's a general test. It might capture 1 to 2% of those that are potentially infectious with this disease. So, you know, I wouldn't take this one to the map. I think it would be appropriate for a lot of facilities, especially if you've got people working shoulder to shoulder, that you're able to at least rule out. If somebody has a fever, they got to go. They got to go home and figure out how they're going to do it. Now, we are, as a society, as a country, ill prepared to carry out any real testing and any real urgency of time to determine, rule out infection by COVID-19. So I think, you know, having that doctor's note is great. You went to the doctor, you're probably more exposed by going there. And they're most likely not going to be able to give you a test that says you don't have it. After you get that test, you know, the next person you run into and are exposed to could give it to you. So the guidance that I give to my clients, you know, yes, take temperatures if it's feasible and you're able to track people. But really, you just assume everybody has it. Having the mindset that every person you encounter, every employee that walks through the door, every customer that walks through the door, every vendor that walks through the door, you treat them, you assume that they are infectious. Now, implement the procedures that will minimize the risk of them spreading it.
And I think you've just segued into the next topic. So I'll let David, I'll let you go again or continue on. And that is the question of, we've got quite a few questions around masks. Should we require them? Should it be optional? What if an employee does, and I'll save this one for you, Dave Bush, or what if an employer refuses to wear a mask? And customers, should customers wear a mask? So David, I'll let you start off, and if you want to throw in the 6-foot concept as well, that's fine. But give us your thoughts on masks.
Well, you know, as an industrial hygienist, we separate respirators from, you know, as part of personal protective equipment or PPE, from other types of controls. And in no way, shape, or form, even though they're often confused and conflated and lumped in the same bag, surgical masks, cloth masks, dust masks are not respirators, period. And I find it funny, sad, a little freudenscheid is, we are discussing N95s as if they are the be-all, end-all. And in the world of industrial hygiene and respiratory protection, that is the bottom of the barrel. That is the lowest rated protection you can offer anybody, anywhere, anytime. And now that is the coin of the realm. You know, P100s, elastomeric half-face respirators, full-face respirators, PAPRs, all these are way higher, what we call assigned protection factors. So N95s, we're already starting out at the bottom of the barrel of any type of real protection. Masks should really be thought about as more of an administrative control. It really falls into the same realm as boot covers or booties or shoe covers that you put on so you don't track dirt inside your customer's house, or coveralls that you may put on so that the skin and the hair don't contaminate the food process. A mask would fall into that. It's not protecting the wearer, it's protecting the environment from the wearer. And I think, you know, just keeping that in mind, I believe we are going in this society, especially once we start major reopenings, you're going to see increases in cases, period. It is unavoidable. It is a forced reintroduction of people. We do not have a vaccine. We do not have a treatment. We do not have a rapid test. You will see increases in disease rates around the country as we reopen. It's unavoidable. So one layer of protection can be wearing of masks. And I think whether we like it or not, it's part of it. But it's not personal protective equipment. It's really environmental protective equipment from protecting the environment or the office space or the factory floor from the workers. It's low intensity. It's has little impact on people. And one of my clients, they have a retail store where they have customers. They're selling pharmaceuticals, and 2 or 3 of their employees said, no, we can't wear masks because we have PTSD. And as a policy, they went with the direction of, this is part of the new uniform. If you can't do this, you can't work here. And they looked at it under ADA as Americans with Disabilities. Was there any other reasonable accommodation they could provide these staff? One of them was a driver. One of them was a salesperson. The driver they could work something out with, but the people who work the front counter, that's the new uniform. And it's not something that requires respiratory protection. And they had to tell them, you either wear this or you go home and find someplace else to work.
Tim, your thoughts on masks?
David mentioned that N95 was the bottom, and you can actually go much lower. Surgical masks are worse than N95s by far. And that's what most people are wearing today. And like David said, it doesn't protect you from anything. The whole idea of a surgical mask is not getting the surgeon to spray on them. And that's what we're looking at. So the N95 is to me, it's great, but it's not comfortable to wear long term if you're going to be wearing it 8 hours every day. The surgical mask is a lot easier to wear. So if you're going to tell somebody to wear something, try and get something that's really comfortable and not abrasive to the face, and maybe easy cleanable as well. So I would go with the surgical mask, and I strongly recommend that masks be required. It's another simple step that can be done that said you took as an aggressive policy as you could. So yes, surgical masks are easy.
And I think, Dave, Dave Bush, I saw your head shaking when David was talking about the example of the employees not wearing them. So I'm assuming from a legal standpoint, you can require employees to wear masks. Yeah.
Absolutely. And it makes perfect sense, because in the sense that you are not protecting the wearer, but you're protecting the rest of the world from the wearer, it's even more, makes more sense that we can do that. We can require you to wear a mask to prevent you from infecting your coworkers in the event that you have you have the disease. And interestingly, from the employer standpoint, implementing a policy that would absolutely, just what David suggests, require, if you don't wear this, you cannot come to work. You can't, and if you chronically absolutely refuse, you can't work here. Then you, in OSHA, if you have such a policy, a safety policy, and there's a violation, well, it is a defense to the employer that they've implemented this policy, they require it, and the employee's refusal to comply is a defense. I've defended cases in that sense, where the construction workers that just wouldn't wear safety harnesses or tie-offs, and that's a legitimate defense. But you need the policy, and it has to be consistently applied. I actually won a case where the plaintiffs were, or the employer was using that defense, but we were able to show that they never really enforced it. It was a paper kind of policy only, that it wasn't really. Once again, same thing I'm saying with the documentation. If you're going to document something, if you're going to put something on paper, it has to be real. You don't just put it on paper. But the masks, yeah, I think they do make perfect sense. It's it's strange. You see the government in any of the at least in Pennsylvania, Governor Wolf's directives are pretty much directed at the stores. You can't order me to wear a mask, and then it's up to the store whether or not they enforce it, whether they permit people to enter or not. So with the employer, though, it's different. You could write a work policy. It doesn't have to be obviously permanent, but let me just say there's going to be issues, and David alluded to them. I've seen people, or have read people on Facebook that have said, I can't, I have difficulty breathing, and that impedes my breathing. And you may have that with your employees. You may have skin consideration, rashes, and things of that nature. So once again, the employers may have to, this is a work in progress. We're all being confronted with situations and problems. Who would have thought of?
Yep.
So you're gonna have to roll with the punches and come up and deal with policies, because they're not all going to be directed. But again, you're not going to have CDC or OSHA being able to address every scenario. So you're going to have to use common sense as when you create these situations, or when you have to address these situations.
Yep. All right. So I'm going to start. We got to start closing this out. So the one other topic I think that is important to our participants and that has come up in questions, and it's definitely covered in the guidelines, is the whole cleaning and sanitizing concept. So David, I'm going to start with you, and just I guess give your thoughts and your guidance as it relates to cleaning and sanitizing, and when to do it, how to do it, and all that stuff.
Okay. In a nutshell.
And you have 1 minute. Yeah.
And I have 1 minute. Okay.
No,
AIHA. Well, AIHA has put out a guidance. I'll say a fact sheet on considerations and things you should think about as a building owner on their COVID-19 website resources. So that's one place to start. I was just on a call this morning, recognizing that document is at that 30,000 foot level. It's a very high level document. These are some things you should do. These are some things you should avoid. And one of the things, pardon the pun, is the Chinese fire drill. You're informed that you have an employee or a customer who was diagnosed a week ago and was in your shop 2 weeks before that, and then all of a sudden you're dropping $50,000 to $75,000 to have your facility deep cleaned, which we don't know what that means. Damage is done. So what we are advising as an association is that we establish a higher level of ongoing cleaning and disinfection throughout the day, throughout the occupied spaces, throughout the workspaces and the customer areas and common areas, and applying a high level of what is normally seen in hospitals. And we're moving those principles and practices and procedures into the normal workplace to try to control pathogens. So, rather than bringing in the team of super cleaners in hazmat suits, how about we have 2 or 3 folks who are trained, equipped, and evaluated and supervised to clean, which is one thing, and then disinfect, which is another, using appropriate disinfectants that have been at least are listed on the EPA in list. We think that's going to be more effective and useful. The fogging, the blow and go, the bug bombs, they're dangerous. I've seen them cause more problems than they solve, and you really don't know what you're getting with that.
Yeah, I found that interesting in reading the AIH documents. So I wanted to, if you didn't bring it up, I was going to ask you about the fogging, because I think in the last safety webinar we had on COVID-19, I think I remember some of our members saying that they have brought in folks to fog the entire plant, or I've heard it being used in the chicken plants, I guess, or whatever. And so I wanted everybody to hear what you said, at least from the industrial hygiene standpoint. Fogging is not always the best approach. Thank you.
And as soon as they're done, as soon as you bring in the next person, you've reintroduced the pathogen.
Yeah.
So, spending all that time and effort and not just picking at it slowly, continuously, I think is probably a misuse of resources.
Tim, Dave, any other thoughts on cleaning? And by the way, thank you, David. As actually, my early days, I was a health inspector. And so the clean and sanitize, thank you for emphasizing the clean part. You got to clean it first before you sanitize it. But anyway.
We'll keep hitting that drum.
Dave or Tim, any other thoughts related to disinfectants and cleaning?
Just my thought, and what David said. You clean it, you fog it, you do whatever is possible to do. And 10 minutes later, a guy come in, just got off the subway. He brings it in, and he infects the place after the fact. At this point, again, I'll reiterate, we're in new turf here. Everybody were trying, you're dealing with a scenario that the thing that I found it unique about this disease that it lasts so long. It would last like 3 days on surfaces, metal and plastic. So you're never going to have a panacea. You're not going to have a situation doing those types of approaches, cleaning, sanitizing, that are going to eliminate permanently or going to eliminate every surface. I mean, you might miss the one particular spot that is infected and you did everything else. The other problem I would suggest or see is one-time deal wouldn't work. And I think that was what David was saying. You have to maintain it because you can't just rest on your laurels. Say, well, we defogged it, we spent $10,000 getting the place cleaned up to open, and then we didn't do anything after that.
Right.
It's an ongoing process. It's not going to be pleasant, but the more you do, the better you're served. So in that regard.
All right, thanks, Dave. I'm going to now give you guys the final question. Tim, I'll have you start off, and the final question is basically this to all three of you. What is it you would like the attendees, if they walk away with one or two things out of this hour of discussion, what is it you would like them to walk away with? And Tim, I'll open it up with you.
David mentioned earlier, and I enforce this, as buildings open, more people are going to get sick. That's a given. I've been in situations where building owners were devastated by outbreaks. Went through one where Dave was in depositions, and the building owner was crying after being deposed in an outbreak where 2 people died and 10 people were hospitalized. So our goal is not to prevent illness. We can't do that. It's going to happen. We want to prevent outbreaks. We want to prevent massive illness. We want to prevent failures due to inaction, and that can be done. So that's the objective of this call, and hopefully people got something out of it that will help them prevent outbreaks and large-scale illness and protect themselves and their employees.
Dave Bush, how about you?
As I said, I think when we were talking beforehand, I go by the old Sun Tzu philosophy that the general who makes the most calculations is most likely to win. Think about now the fact that these folks are on here. It shows that they're interested, that they're concerned. Glean whatever information you can from ours, particularly from Tim and David. They're the experts in that. Obtain as much information as you can that's reasonable, and be prepared to implement policies and change your ways to address this situation. It might be difficult, but honestly approach the situation using reasonable and common sense approaches in terms of sanitizing and call out policies, things like that, recognizing it may impact somewhat commercially. There's no getting around that. But if you do it honestly, and once again, please, if you're going to documentation is very useful, but it also, if you do it wrong or you do it improperly, it's going to be problematic. But gather the information, have a game plan, and follow as much as news as you can. You're not, as David pointed out, David Crowd and Tim just said, there's no way you're going to absolutely prevent it. But if you're showing good faith efforts, reasonable efforts, that is protection. And, you may benefit from it in the sense that you may prevent it, but at least legally you've shown really reasonable efforts. Bear in mind, with employees, you're dealing with workers' comp. Workers' comp is strict liability. So you get employees that get sick. You may have they have a claim regardless, even if it's established that it occurred in your workplace without any negligence on your part. If you have commercial traffic, customers, and even vendors are significant because they're considered third parties. At least you have a legitimate defense that you have taken reasonable steps to ameliorate a problem.
And David, you get to almost close it out. I gave the official closer, but you got the second to last closing.
Well, wonderful. Thank you. And gentlemen, thank you for all your insights. I'm going to reiterate what Dave Bush said, is that have a plan. Sit down, think your way through this. But number 2, be skeptical. You will be presented with options of, here's the one thing you need to do. Here's the magic bean you need to plant. Here's the one device you need to do. Here's the one chemical you need to buy. This pandemic has not changed human nature. There are shysters and snake oil salesmen and miracle workers out there, and they are out in droves right now. Ask for guarantees. Ask for references. Ask for registration numbers. Ask for data to prove that if what they're selling is too good to be true, you can assure yourself it is too good to be true. So, have a plan, develop your defenses in depth, and be ready to adjust on the fly. So thank you.
Thanks to all three of you. Everybody should now be seeing on their screen the suggested resources, the ASA web pages. If you go to the safety pages on the ASA web pages, you'll see a long list of documents that are also on this slide, but also on our website. Reference to the OSHA guidelines, the CDC guidelines that we brought up. EPA has a list of approved disinfectants for this application. See there, I said AHIA in the acronym, David. I'm so sorry. But it's
we haven't done ourselves any good with our any favors with our names.
Okay, so the American Industrial Hygiene Association, these links will get you to the web pages and documents David brought up. And when you go to the Legionella Risk Management page here, that'll talk about the two documents Tim talked about related to flushing and helping to get the buildings back up and working. So thanks to the three of you. I really appreciate all the time you spent preparing for this and your insights. And I know that our panelists, our members, and those who attended are pleased as well. So thank you all. Stay healthy and have a good one.
Thank you. Take care.
Thank you, gentlemen.